So are you finding there is resistance in horses?
Yes, we're seeing, basically we have about 5 or 6 active ingredients available to us in New Zealand, and we're seeing nearly 100% failure in on some properties to 2 classes of drug that we use, and in a small percentage of horses we're seeing 100% failure across all products available. So obviously this is quite alarming, and we are having to look at alternative ways of managing those properties, which we go into with our program. The main worm of concern for adult horses and young stock is the cyathostome worm, also referred to as the red worm or the bloodworm, which causes a whole raft of disease processes in the horse: weight loss, anemia, it can lead to death. So this is the one of main concern, and we're seeing a lot of resistance within that type of worm to all our products. And in foals, also especially through the Waikato, they're having issues with resistance to the ascarid worm or roundworm, which has also developed its own resistance to many of the products we use.
So once a horse has resistant worms, what can you do about it?
We run fecal egg count reduction trials. Basically we take a day 0 sample across as many horses as possible on one property. So we run a fecal egg count on that sample, and then we test the horses with different products, and then perform a day 14 repeat sample to see the difference between the day 0 and the day 14 sample. So the reduction in egg numbers between the day 0 and day 14 allows us to calculate how efficacious that product is on the property. So for most drugs you would need to see at least 98 to 99% reduction to deem that product working on your property still. And on many properties we're seeing only about 30% reduction to some products, so not working at all really effectively. So if we can pinpoint a product that is still working on the property, then we will use that one for that property. We implement cross-grazing with other species. Sheep and cattle will mop up horseworms and kill them with their digestive processes. So we advise on timing of the cross-grazing with the horses to maximise the mop-up effect. There's only one worm that they share in common, and that doesn't cause disease in the horse. If there is a full-blown resistance issue to most of the active ingredients, then we can even go to extremes of re-sowing pasture just to try and eliminate some of the contamination of the resistant worms.
So there is hope that, like, you don't have to put the horse down or anything like that?
No. As long as you're working in with your vet to identify which products are working. The fecal egg count reduction trial is a huge tool for us that's been underutilised when we're trying to identify resistance. So that's the first step. Even getting people to do a simple one-off fecal egg count is better than nothing, than just blindly treating them every 8 weeks with a product that may or may not be working on your property. Historically, horses have been treated every 8 weeks due to a large strongyle worm. It used to be the recommended treatment interval to manage that worm, but that worm is no longer a problem for us. It's being managed well. In actual fact, if you perform the test through the program that we're advocating, you may find that your horse only needs to be dewormed twice a year, which is really going to reduce the pressure on your paddocks and the worm populations there, and minimise the incidence of resistance.